Dimensionality reduction of data on patients with diabetes mellitus of multidimensional scaling. Diabetes mellitus is a disease characterized by increased blood sugar levels, leading to damage to the kidneys and nervous system, impaired vision, and affecting the state of nervous and vascular systems. There are different types of diabetes depending on which patient requires special treatment based on lifestyle changes, dietary choice, and medications. The disease can progress without symptoms for a long time, so many do not seek medical help promptly. The most common is type 2 diabetes, which is characterized by high levels of insulin with low sensitivity of body cells to it. This leads to damage to internal organs. The patient damages the retina, small vessels, nerves, and kidneys. As a result of malnutrition of the skin on the ankylostrophic ulcerous form. More than 400 million adults live with diabetes worldwide, which is growing early. More than 60 million people have diabetes in the European region. To date, there are no official statistics on the incidence of diabetes in Ukraine. In 2017, 1.27 million people with diabetes were registered in Ukraine. Among them, 200,000 patients need daily insulin. One of the most effective tools to combat diabetes is its prevention and early detection, using mathematical modeling and information technologies to support doctors' decision-making when making medical diagnosis is practical. The problem is building models of medical diagnostics is the redundancy of data. Therefore, reducing the dimensionality of data of patients with the suspected disease is an urgent task. This study aims to develop a model to reduce the dimensionality of the patient data on the incidence of diabetes based on the maximum likelihood method. The more information about the objects of study in the form of a set of characterizing features will be used to create a model, the better. However, too much information can reduce the efficiency of data analysis. It is important to know that not informative features are source of additional noise and affect the accuracy of model parameters estimation. In addition, data sets with a large number of features may contain groups of correlated variables. The presence of such groups of features means duplication of information, which can distort the model specification and affect the quality of the estimation of its parameters. The higher the data dimension, the higher the size of calculation during the algorithmic processing. High dimensionality can mean hundreds, thousands, or even millions of input variables. When dealing with high-dimensional data, it is often helpful to reduce the dimensionality by projecting the data onto a subspace of lower dimensions that retains the essence of the data. This is called dimensionality reduction. More minor input data often means fewer parameters or a more straightforward structure in a machine learning model called degrees of freedom. A model with too many degrees of freedom is likely to overflow the training data set and therefore may not work correctly on new data or not work at all. The multidimensional scaling methods is one of the well-known non-linear dimensionality reduction methods used to analyze the similarity or difference of data by reducing data to a low-dimensional space. It is also important to note that this method is one of the first fundamental teaching methods. Multidimensional scaling, MDS, is a set of statistical methods dealing with the problem of constructing in n-point configuration in Euclidean space using the similarity information between n objects. It is not necessary to rely on differences between Euclidean distance objects. They can represent many types of differences. MDS aims to reflect objects before the configuration or embedding of points in such a way that the given differences are well approximated by the Euclidean distance. MDS generally attempts to model data such as distances between points in geometric space. The main reason for this is that a graphical representation of the data structure is required, which is much easier to understand than an array of numbers, and in addition reflects essential information in the data, smoothing out the noise. In MDS analysis, the data is typically embedded in a 2D or 3D map such that given similarities or differences, the information matches the distances between points exactly. Objects of interest, such as objects, attributes, stimuli, respondents, etc., correspond to points in such a way that those nearby are empirically similar and those far apart are considered different. To evaluate the simulation result, two metrics were applied: Euclidean distance and Manhattan distance. For the experimental investigation, the Palmer diabetes dataset has been used. Distribution of the values by parameter is presented on the slide. The software implementation of the data dimensionality reduction model by the multidimensional scaling method was carried out in the Python programming language in the Anaconda programming environment. The table on the slide shows the input of the data. After that, the console will display information about the dissimilarity matrices distance, new data sets, stress indicators for the multidimensional scaling method based on two metrics, Manhattan and Euclidean. Table on the slide shows Manhattan MDS. Table on the next slide shows Euclidean MDS. Left figure shows a visual representation of the Manhattan distance dissimilarity matrix. The right figure shows a visual representation of the Euclidean distance dissimilarity matrix. On graphical representations, you can see that each is symmetrical and contains zero values on the diagonals. Left table shows new dataset according to Manhattan MDS. Right table shows new dataset according to Euclidean MDS. As we can see, for multidimensional scaling based on the Manhattan distance, the stress factor is 0.17. Which is sufficient reason to doubt the results reliability. Understandably, the number of features set for new data is not optimal for data dimensionality reduction. It is better to set the data dimension to more than 2 to avoid such a situation for a given set. In turn, the stress factor for multi-dimensional scaling using Euclidean distance is 0.11, which is also not ideal but acceptable to rely on the results obtained. But do not forget that the data is still built with possible errors. The new data sets contain information about 768 patients, but not with 20 features as initially, but with only 2. This is due to the specified data dimension. These received features include a geometric justification. Each data pair represents x, y coordinates. These coordinates will be used to visually represent the results of data dimensionality reduction. It is important to note that the axis and the resulting plots alone do not make sense and that the figures orientations are arbitrary. Figure shows a visual representation of the result. The graph called MDAs, Manhattan distances, is a reflection of multidimensional scaling using Manhattan distance and called MDS Euclidean distances, is a multidimensional scaling method using Euclidean distance. In the resulting graphs, each point corresponds to a patient, which means that the graph shows information about 768 patients, but this information only shows the dissimilarity between patients. This can be explained as follows. If 2 points are near, this means that they have similar indicators. But if 2 points are far apart, this means that these important features presented at the beginning in these patients are very different. The task of dimensionality reduction is relevant for the application of mathematical modeling methods and information technologies to support doctors' decision-making when making diagnoses in conditions of limited resources. Within the framework of this study, a model for reducing the dimensionality of medical data was built based on the multidimensional scaling method. An information system for automated data processing has been developed in the Python language. Diabetes mellitus type 2 was chosen as the object of study, the containment of which is especially relevant in the context of escalation of the Russian war in Ukraine. As a result of the study, the Indians diabetes dataset was processed, consisting of 768 records and 9 attributors. After processing, the new dataset consists of 2 attributors. Manhattan distance is 0.17, Euclidean distance is 0.11.